Hello everyone, welcome to our channel Physiomax Organization and myself Dr. Taposh. We are continuing our medical educational series, and under this part we are continuing the shoulder or the glenohumeral joint different pathological condition. As from the last video you people have seen that we have already covered the different pathological condition like the subacromial bursitis, supraspinatus tendinitis, periarthritis shoulder or the frozen shoulder, and the difference between the supraspinatus tendinitis and the subacromial bursitis or the rotator cuff tendinitis. Today we'll understand about the detailed pathomechanics or the detailed mechanism of injury of a particular condition like the subacromial bursitis. So come, let us see what exactly this is the subacromial bursitis, why the subacromial bursa will go for the injury, and what's the cause this subacromial bursa differs from the supraspinatus tendinitis. Also, if someone is having a subacromial bursitis, how we'll understand it can be a subacromial bursitis. Come, let us see the all detailed and the pathological condition about the subacromial bursitis. Before that, don't forget to like this video and don't forget to subscribe to our channel to know all the detailed pathomechanical conditions related to the orthopedic areas. Come, let us see. So first we need to understand where exactly this subacromial bursa is. So first, by the name we need to understand that the name of this condition is the subacromial bursa. So before that, we can see over here, this is the region which is named as a acromion process. This acromion process is the continuation of the spine of scapula. So this is the acromion process, and just below of the acromion process, if I just hold the humerus like this in this position, this space what it is called as a subacromial space. So this space it is called as a subacromial space. So in this space, normally the tendon which passes is the supraspinatus tendon like this from below of the subacromial space. Now this supraspinatus tendon are protected by the structure which is named as a subacromial bursa. So what is this subacromial bursa is? It's a fluid filled sac. It's just like a capsule which is filled up with a fluid which is named as a synovial fluid and having its membrane, and which is very thin in structure and which is present in this. Then what's the function of this subacromial bursa? The main function of this subacromial bursa to protect the supraspinatus tendon whenever we do any sort of activities which is within this 90 degrees of the humeral abduction or any sort of activities which needs a repeated motion. So yes, this subacromial bursa, it acts like a mantri. So if we understand the story that whenever someone goes for any type of war, the king is never get targeted at the first. The persons who protects the king, they get targeted. Same like the story. Subacromial bursa is the one whenever the shoulder joint will go for any sort of impingement or overused or repeated trauma type of injury, the bursa which gets inflamed is the subacromial bursa. And remember, if this subacromial bursa will die, then only this supraspinatus tendon will go for the further injury. So to remember, subacromial bursa is the first one to go for the injury, and resultant the supraspinatus tendon will go for the injury. So we understood why the subacromial bursa and where is this subacromial bursa is present, and what is the cause of having this subacromial bursa to go for the injury. Now we will understand why the subacromial bursa will go for the injury. If you do any sort of repeated activity at the level of the 90 degrees of the humeral abduction, that is the main cause of the subacromial bursa to go for the injury. So we have understood the reason why subacromial bursa will go mostly for any type of pathological condition. Now we need to understand that if this subacromial bursa, is it a acute condition or it's a chronic condition? To understand that, any sort of impingement related to a repeated trauma, it is always acute in nature. Subacromial bursa, it's a pure acute condition which mainly occurs because of the repeated trauma, and this type of pain which is mostly localized to just below of the subacromial space. And whenever we used to see the patients, whenever we used to palpate the area, we feel that area is having is increased temperature and the patient is to have a localized pain. And by that, we understand that the patient is having a subacromial bursa. We are having a different result test and we are having different physiotherapeutic treatment modalities to treat this subacromial bursa. For the upcoming video, we will make you understand that how we'll understand that the patient is having a subacromial bursa. I hope from this short of pathological condition understanding, you probably understood that the cause and the area where the subacromial bursa the patient is to have a pain. So if I just exactly show on the body, so this is exactly the region where the subacromial bursa is to go for the injury. Remember, not only for the repeated motion, suppose you are holding any object while traveling by the bus or the metro, and if suddenly there is a sudden break and if your hand will go for a rotation, that also can make the subacromial bursa to get impinged, and that makes the subacromial bursitis. Apart from that, any site of throwing activities where needs there's a 90 degrees of repeated motion, that makes the subacromial bursa to go for the injury. Again, any type of 90 degrees activities, exactly like the rowing type of activities, that makes the subacromial bursa to get impinged. Even for the swimmers too, the subacromial bursa can go for the injury. These are the main cause of the subacromial bursa to get inflamed. Yes, if it get treated within an acute stage, it can be have a complete recovery. But if you delay while treating the subacromial bursa or the patient make make as a chronic condition, then it's very difficult, and that makes the supraspinatus tendon to go for the injury. So it is always treated whenever someone is having a primary level of injury to get treated at the first. I hope you people understood the cause in a detailed way. So those who like this type of video, don't forget to subscribe our channel, and if you like this video, don't forget to like this video. Thanks once again. We'll be coming with a new series again. Thank you.